I've had nasal polyps about 20 years. I had my first sinus surgery when I lived in Los Angeles. My second surgery didn't go very well. My nasal polyps came back and it was just, back to where I was before.
When Ms. Bush first presented to me, she had come to me as a third or fourth opinion on evaluating and getting an angle on management of her very difficult sinus disease, as well as her lower airways disease. This really left her quite debilitated.
I'm a global executive doing research and development, and I have facilities all around the world. One of the things that my nasal polyps used to get in the way a little bit was around my traveling. Jet lag was harder. I would always feel like I had almost like a low-level cold sinus infection.
As her autoimmune disease ensued and actually progressed, it became quite clear that the polyps had returned into her sinuses. We decided to revisit the issue of sinus surgery.
There was a couple of things that were different about the surgery this time. She was going to do it with, it's almost like an ultrasound. Clear, I think.
Okay, awesome, that's great. Okay, let me take a good look.
It is not enough just to open up the rudimentary openings to the sinus drainage passages, but it is important that we actually ventilate every nook and cranny that we can get to where the polyps can hide. When the surgery was initially developed, there was one form of surgery that was applied to what was thought as one form of a disease. And now we know that there are many forms of sinus disease.
But the polyps, the growth seems to be under control, which is fine.
Ms. Bush has had really good response to the surgery as well as the medical regimen that she has been put on. She has no evidence of recurrent polyposis as we speak.
Are you getting anything out through your nasal rinses?
Not much anymore, not much.
And you're still open?
I'm still open.
You can
still smell and taste, that's great.
That's awesome.
It was really a wonderful experience for me to interact with somebody who's so willing to engage and be part of the treatment and the whole journey.
It's definitely worth it. Go get the right care from the right specialist. It's around the right quality. You won't regret it.